Hello everyone, we are group number 5 and this is our project reducing the environmental impacts of antibiotic wastage. This is our team and these are the topics we will be talking about today.
Climate change refers to any long-term changes to weather conditions, including changes in temperature, rainfall, and precipitation. Most of the changes are as a result of humankind action. Did you know healthcare accounts for about 5% of global greenhouse gas emission? With medicines making a substantial contribution. This is from toxic exposure to pharmaceutical products, especially antibiotics and cytotoxic drugs, released in the surrounding environment during production of antibiotics and overprescription of antibiotics and discarding of expired antibiotics. Antibiotics are a group of medications that kills or slows down the bacteria. They are used to treat infections such as UTI, STIs, and many others. Antibiotics can also be used as prophylaxis for future infections. The 15% of emission are shown to be from antibiotics: amoxicillin, which inhibits bacterial cell wall synthesis, fluoxetine, which breaks down the bacterial cell wall, and penicillin V, which inhibits bacterial cell wall synthesis.
Many antibiotics are not fully metabolized and are excreted out and into sewage systems. Patients also commonly dispose of antibiotics incorrectly at home instead of at the pharmacy, resulting in high concentrations of antibiotics in sewage. This sewage can contaminate water supplies, with antibiotics having been found in 65% of sampled rivers globally, as well as land via water and feces from proactively treated livestock. A way that this can cause harm is by encouraging survival of resistant strains of bacteria that can spread to humans and livestock, forming a positive feedback loop due to an increase in antibiotic need and as a result wastage. There is also a decrease in microbial diversity due to dominance of these strains, disrupting ecological processes such as nutrient cycling and organic matter decomposition.
The discovery of the antibiotics was one of the principal advances in medicine history. The prognosis of bacterial infections improved drastically, and many healthcare procedures were radically modified. Before Fleming discovered penicillin, infectious diseases were the leading cause of death worldwide, with around 75 to 85% of patients suffering from bacterial meningitis dying. The spread of bacterial wound resistance to antibiotics has become a global threat to public and individual health. The clinical environment constitutes a source of antibiotic resistance due to widely extended use of antibiotics, which exerts a natural selective pressure on bacteria. The incorrect use of antibiotics and their overuse are the main factors that facilitate and condition the spread, causing a significant increase of sanitary costs.
In some countries, patients have unrestricted access to antibiotics. Our first solution, therefore, targets patients to reduce the overuse of antibiotics. We propose to implement patient decision aids (PDAs), which are tools to help patients make informed care decisions based on the evidence and their preferences. The PDAs would be short educational videos using data-driven educational content to raise awareness on the impact of antibiotic use on climate and health. Testimonials from the community would also be incorporated. Data from health records would be used to provide personalized information on reducing antibiotics overuse. Engaging the community in the design of the videos using local languages and environmental challenges would be crucial in their effectiveness.
In regards to healthcare, hospital wastewater must be closely monitored and treated to prevent harmful pollutants from endangering ecosystems. Antibiotic residues in the wastewater are particularly resistant to treatments. Our solution includes real-time monitoring using lot sensors for antibiotics, chemical oxygen demand, and microbes, transmitting data via the internet. Additionally, we propose an advanced treatment methods such as ozone oxidation, UV photolysis, and membrane filtration, like nanofiltration or reverse osmosis, alongside bioaugmentation to enhance the antibiotic degradation by introducing native microbes to the contaminated sites. Our project aims to establish a closed-loop water reuse system in hospitals recycling treated wastewater to reduce environmental impact and promote sustainable healthcare practices.
The problem within the industry is the lack of regulations involved in antibiotic production, leading to excess environmental impacts as described earlier. An example of this is the absence of regulations for the emissions of active pharmaceutical ingredients, which are theorized to lead to antibiotic resistance. This can be overcome using life cycle assessment, a quantitative method used to look at environmental impacts of a product from their production to disposal. This life cycle assessment would allow for the analysis of the production of antibiotics to evaluate their environmental impact and offer positive change where needed. In conclusion, antibiotic overuse and wastage significantly impact our environment and health. To combat this, we have suggested the use of patient decision aids to reduce unnecessary prescriptions, closed-loop water reuse systems to minimize antibiotic discharge, and life cycle assessments to identify critical impact points. Tackling these challenges requires collaboration across healthcare, industry, and government sectors, as well as the public, to ensure a sustainable future. Thank you for listening.